Pamela Reynolds Lowery was a musician from Atlanta, Georgia. She was 35 years old. In 1991, she was diagnosed with a large basilar artery aneurysm, an aneurysm deep in her brainstem. The only surgical approach required something that had never been done for the specific procedure. Her heart would have to be stopped. Her blood would have to be drained from her body. Her brain would have to be cooled to 60 degrees Fahrenheit. By every medical measure, she would be dead for 45 minutes. When she woke up, she described what had happened in the operating theater while she was dead. She described the specific surgical instrument that had been used to open her skull. She had never seen it before. It is not a common object. She described it with precision that made the surgeon, who operated on her, stop mid-sentence when she told him. He had not expected that. She was dead for 45 minutes. What she saw has never left her. The procedure Pamela underwent is called hypothermic cardiac arrest. It is used in a specific category of neurosurgery, where the blood flow to the brain must be stopped entirely and the brain's temperature reduced to protect the tissue from damage during the period of no circulation. At 60 degrees Fahrenheit, the brain's metabolic rate drops to approximately 10% of normal. The electrical activity in the brain, the activity that constitutes consciousness, memory, perception, experience, ceases entirely. This is not a coma. This is not deep anesthesia. By every standard neurological measure, the brain in hypothermic cardiac arrest is not experiencing anything. It cannot be. The electrical substrate for experience is not operating. The surgeon who performed Pamela's operation was Dr. Robert Spetzler, Barrow Neurological Institute, Phoenix, Arizona, one of the foremost neurosurgeons in the world for this specific procedure. Dr. Spetzler is not a man who endorses supernatural claims. He is a scientist and a surgeon. He has verified the details of what Pamela reported to him when she woke up. He has stated in interviews and in the medical literature that her descriptions of the operating theater, the instruments, the team, the sequence of events were accurate. He does not have an explanation for how. When Pamela woke up, she described the following: the specific surgical instrument used to open her skull, its appearance, the sound it made, specific words spoken by members of the surgical team during the procedure, the music playing in the operating theater at specific moments, her position on the table, the angle of her head, the specific position of the surgical team around her. She described watching the procedure from a position above and slightly behind her own body. All of these details were verified against the operating records and the recollections of the surgical team. All of them were accurate. The bone saw. This is a detail that the surgical team found most striking. The Midas Rex pneumatic drill used to open Pamela's skull is a specialized instrument. It does not look like the instruments most people associate with surgery. Pamela described it accurately. The appearance, the sound. She said it looked like an electric toothbrush. She could not have seen it. Her eyes were taped shut with surgical tape before the procedure began. The drill had been in a sealed sterile pack until the moment it was used. She had no prior surgical experience that would have led her to expect or imagine that specific instrument. Dr. Spetzler reviewed Pamela's account against the operating records. He checked the sequence of events. She described against the timeline in the anesthesia record. He checked the words she attributed to the surgical team against the recollections of those team members. He checked the music she said was playing. Everything was consistent, not approximately consistent, not possibly consistent, specifically, accurately, detail by detail consistent. He has described this publicly as one of the most challenging experiences of his scientific career. The anesthesia record for Pamela's operation includes the EEG data. The EEG, the electroencephalogram that measures the electrical activity of the brain, shows a flat line for the entire period of hypothermic cardiac arrest. Zero activity. Pamela's brain produced zero detectable electrical activity for 45 minutes and produced an experience that she has been describing consistently, accurately, and in specific detail for 30 years. Pamela Reynolds Lowery died on May 22, 2010, 19 years after her operation. In those 19 years, she described her experience hundreds of times to researchers, to journalists, to audiences, to anyone who asked. Her account never changed. She said, "I know what I experienced. I was there. Whatever your theory is, it does not change what I experienced." Dr. Sam Parnia, resuscitation physician, University of Southampton, currently at New York University Langone Medical Center. He designed and led the AWARE study, the most rigorous scientific investigation of near-death experiences ever conducted. AWARE, awareness during resuscitation. The methodology was specific. Place hidden targets, images visible only from above. In hospital rooms where cardiac arrest patients might be resuscitated, if any patient reported an NDE during which they observed their own resuscitation from above, they would be asked what they saw, and what they saw could be verified against the hidden targets. The AWARE study ran for 4 years across 15 hospitals in the United Kingdom, United States, and Austria. Approximately 2,000 cardiac arrest patients were enrolled. The hidden targets were placed in 140 rooms. The study protocol required that any NDE report be verified against the target in the patient's specific room before the patient had any opportunity to see or learn about the target. This is not a soft protocol. This is a controlled scientific experiment designed specifically to produce objective evidence for or against the claim that cardiac arrest patients can perceive their environment while clinically dead. The AWARE study produced one verified case of veridical perception. A cardiac arrest patient accurately described their resuscitation from a vantage point above their own body. The specific details they reported were verified against objective records of the resuscitation. The patient described details that were accurate, details they could not have seen from their position on the table. One case, out of 2,000 enrolled, but the study was designed to produce either no cases, which would constitute evidence against veridical NDE, or some cases, which would require an explanation. The verified case from the AWARE study, a 57-year-old male cardiac arrest patient. He was resuscitated over a period of approximately 3 minutes in a specific hospital room. During that period, he reported an out-of-body experience in which he observed his resuscitation from above. He described the specific actions of the nurse who was conducting chest compressions. He described an automated external defibrillator speaking to the team, making verbal prompts. He described the specific sequence of defibrillation shocks. All were verified. Dr. Parnia's assessment of his own study's implications is measured. He does not claim that the AWARE study proves consciousness exists independently of brain function. He says that the AWARE study produces evidence that is inconsistent with the prevailing scientific model of consciousness. The model that says consciousness is a product of brain function and ceases when brain function ceases. He says this evidence requires investigation. It requires a better study. It requires more cases. It requires the kind of sustained, rigorous scientific attention that the NDE phenomenon has historically not received because the subject is too uncomfortable. There are 3 standard scientific explanations offered for NDEs. First, oxygen deprivation. The dying brain, starved of oxygen, produces hallucination. Second, REM intrusion. The dreaming state intrudes into the waking or semi-conscious state during cardiac arrest. Third, neurochemical release. The brain releases endorphins, DMT, or other neurochemicals at the moment of extreme stress, producing hallucinatory experience. None of these explanations accounts for veridical NDE. Hallucinations, REM states, and neurochemical experiences are internally generated. They cannot produce accurate, verifiable, specific perceptions of the external environment. Pamela Reynolds described the external environment with clinical accuracy. The AWARE study patient described the external environment with clinical accuracy. Hallucinations do not do that. Dr. Parnia's position is this. The evidence does not prove that consciousness exists independently of the brain, but the evidence is inconsistent with the claim that it does not. That is a scientific statement, not a spiritual one. What it means is the current model is inadequate. We need a better model. We do not yet have one. In a separate but related line of evidence, Dr. Parnia's research team at NYU has also documented cases of cardiac arrest patients. Patients whose hearts stopped for between 30 seconds and 2 hours, who reported coherent and consistent near-death experience content. The duration of the cardiac arrest correlated with the richness and complexity of the NDE content reported. The longer the cardiac arrest, the more detailed the NDE. In a brain that is not generating electrical activity, experience should not be possible, let alone experience that increases in complexity the longer the brain is inactive. That correlation has no satisfactory explanation in the current neurological model. Dr. Robert Spetzler operated on Pamela Reynolds in 1991. He has spent 30 years in the neurological and medical literature trying to find a conventional explanation for what she told him when she woke up. He has not found one that satisfies him. He said in a 2009 interview, "I don't think it is possible to explain the NDE on the basis of what we currently know about brain function. I don't know what to make of it." He is one of the foremost neurosurgeons in the world, and he does not know what to make of it. What the NDE evidence challenges is not religion. It challenges the scientific model. Specifically, the model that says consciousness is a product of brain function, that it arises from the brain's electrical activity, is dependent on it, and ceases when it ceases. This is not a metaphysical or spiritual position. This is a prevailing model in academic neuroscience. And the veridical NDE evidence, Pamela's case, the AWARE study case, and approximately 24 cases of similar quality, documented in the peer-reviewed literature, is inconsistent with that model. The researchers who study this evidence are not fringe figures. Dr. Pim van Lommel, cardiologist, Netherlands, publishes NDE study in the Lancet, one of the most prestigious medical journals in existence. Dr. Bruce Greyson, psychiatrist, University of Virginia, former editor of the Journal of Near-Death Studies. Dr. Stuart Parnia, already mentioned. These are institutional researchers, publishing in institutional journals, reporting institutional evidence. The difficulty is not the quality of the research. The difficulty is the implication of the results. The implication is this: if consciousness can exist independently of the brain, if it can perceive and process information when the brain's electrical activity has ceased, then consciousness is not generated by the brain. The brain may be more like a receiver than a generator, an interface, not a source. That is not a small claim. That is one of the most significant claims in the history of science, if it is true, and the evidence that supports it. Pamela's case, the AWARE study, Van Lommel study, Greyson's archive, is better than most people realize. In one of her last interviews, Pamela Reynolds was asked whether she was afraid of death. She said, "I am not afraid of death in the way I was before. Not because I think I found some magical answer, but because I was there. I was in the process. And I know that what happens in that process is more than the end of the physical machine." She died on May 22, 2010. She was 53 years old. Pamela Reynolds did not come back a different person. She came back a more certain one. And the surgeon who operated on her spent 30 years trying to explain what she told him when she woke up. He never could. Subscribe if this is the kind of question you want to keep sitting with.